Hey everyone, it's Michaela. I'm going to explain my loose parts model. To make my loose parts, I use pretzels, peach rings, Twizzlers, and Cheerios. I use the pretzels to make the vertebrae, or little bones in our back. I use the peach rings to make the intravertebral disc, or the little cushions between our bones in our back. I use the Twizzlers to make the spinal cord and the hip bones and the sacrum. I use the Cheerios to make the little holes in our sacrum. So let's talk about our spine. A normal spine from the back is straight. Our spine is made up of vertebrae, intravertebral disc, and our spinal cord. The spine protects our spinal cord. The spine can be categorized in levels, meaning it can be split up into different levels depending on the section you're talking about. If you're talking about the top section of your spine up by your neck, it is called the cervical spine. The middle section of your spine is called the thoracic spine, and the lower section of your spine is called the lumbar spine. Let's talk about someone with scoliosis though. Scoliosis is where someone has a sideways curve in their back. The cause is unknown. You can be born with it, develop it as you're young, develop it as a teenager, develop it as an adult. Some of the symptoms of scoliosis is back pain, uneven hips, you have trouble while you're standing. So someone with scoliosis is going to have, instead of a straight spine, they're going to have a curve in their spine. So you can have either a C curve, which is a curvature of one direction, or you can have an S curve, which is a curve in both directions to where it looks like an S. Scoliosis ranges from mild to severe. Scoliosis can be diagnosed by your healthcare provider when they do a physical exam. They may also want to look further into it and take some x-rays, an MRI or a CT, which just takes pictures of your back to see the curvature. Sometimes healthcare providers and school programs check for scoliosis yearly, like before sports programs. Scoliosis can be problematic, so it's important that it's treated early. If it's left untreated, it can cause problems with the heart, it can cause problems with lung function. Severe spine curvature can cause nerve, muscle, and tissue damage, which can be permanent, and permanent nerve, muscle, and tissue damage can cause permanent pain that you'll have to live with. Some treatment, it depends on how severe or how bad your scoliosis is. It can be treated with braces, surgery, or spinal fusion. And thank you guys for listening to my demonstration.